Hello, welcome to Physician Academy. Today, the topic will be hyponatremia, and this will be an introductory lecture. Hyponatremia is low blood sodium. It's defined as a serum sodium concentration of less than 136 milliequivalents per liter. An increase or excess total body water in relation to the sodium content of the body. Common causes or etiology would be medications like diuretics, diarrhea, heart failure, liver disease, kidney disease, or syndrome of inappropriate antidiuretic hormone secretion, or SIADH. We need to differentiate between hypovolemic, euvolemic, and hypervolemic. Hypovolemic, or decreased volume, hyponatremia, is a loss of both total body water and sodium with more sodium loss. The body increases vasopressin secretion to preserve blood volume and tissue perfusion, which makes the body hold on to water or retain fluid and causes a drop in the sodium concentration. Extrarenal losses examples would be extrarenal losses, which would be third spacing, fluid leaving the vascular and entering the tissues. Example would be peritonitis, pancreatitis, or small bowel obstruction, and also burns. Another extrarenal fluid loss would be GI, would be the diarrhea or vomiting, or both. Renal losses, renal fluid loss, that would be from the kidneys or the nephrotic system, and it would be from diuresis, from diuretics or osmotic diuresis, interstitial nephritis, or polycystic kidney disease. Euvolemic or normal volume hyponatremia is a total body water is increased even though extracellular fluid volume is normal. Medications that can cause this would be thiazide diuretics or carbamazepine or chlorpromazine. Drugs would be like opioids or MDMA, also known as ecstasy. Other drugs that can cause this would be SSRIs or non-steroidal anti-inflammatory or oxytocin. The endocrine disorders that would cause this would be hypothyroidism or SIADH, the syndrome of inappropriate antidiuretic hormone, and this is common in cancers of the GI or the CNS, and then also adrenal insufficiency. Another cause for euvolemic hyponatremia would be polydipsia. Another one would be increased non-osmotic release of vasopressin or ADH, and this is usually due to pain or emotional stress or nausea. And then there's hypervolemic increased volume hypernatremia, which is increased in total body water and total body sodium. These are edematous disorders. There is an increase in vasopressin and angiotensin II, which work to retain water and increase plasma volume. And the examples of these would be heart failure or cirrhosis, or acute or chronic kidney disease or injury like nephrotic syndrome. So how is this diagnosed? It's common to diagnose this by doing a basic metabolic panel, peripheral exam and fluid volume assessment. So you'd find peripheral edema or ascites. Treatment is usually in hypovolemic hypernatremia is IV normal saline. In hypervolemic, it's restrict fluids, and in euvolemic hypernatremia, it's look for the cause and treat that. To follow this lecture, we're going to have more lectures to detail about the diagnosis and treatment options and to go into further depth on the subject. Thank you.